Hello, and this is Dr. Croley, and welcome to Case of the Day. We're starting a little different, so I'm sort of incognito at the moment. This is an image of a retina, and you can see where there's four different images, and there's a new system called Optos, which is a camera that's able to take the whole inside picture of your retina in one view, and you can see the little small areas that are brighter light. That's what a normal camera or a normal instrument that we use to look inside the eye, it can only see a small portion inside the eye, versus the new Optos camera is a huge area, almost the whole retina in one view. So I'm going to back this away and then we'll discuss what you just looked at. So, Optos is a camera system that is able to, with unique technology, image the whole inside of the retina. An engineer actually in Europe had his son who had symptoms of a problem in one eye. It turned out that that son had a retinal detachment that was undiagnosed, and he got so upset about his son losing vision in one eye that he decided he would develop a system that would not happen again. So he, through a lot of years of hard work, has come up with a camera that's able to image the whole retina, essentially, in one view, and that way the retinal detachment would not be missed. So we, just as a case, is to make a point, we had a gentleman come in who's seen several eye doctors, been to a couple of universities with different eye problems, and came in today with a different problem, such as flashing and floaters, which we examined and took care of. But I was able to see his whole retina through this system, and I noticed that in one eye that he had a mole in the back of his eye, a freckle or a nevus that was present, and no doctor had ever seen this, ever told him about it. He's 60-something years old. He's had cataract surgery in both eyes, and no one has ever noticed this little freckle or mole or nevus that was sitting in the back of his eye. It's benign, just like the moles on your skin, but it's something that needs to be noted, that we now have an image of, and it's more likely it's turned into a cancer than one on your skin. But the problem is you can't see the one in your eye. If something grew on your skin, you would go have the doctor check it. But in the eye, you can't see that. So now we have a great image of what that little mole or freckle looks like. And so if it ever changed, we will be able to know it right away and then do something about it. So this is where this new technology is allowing us to be better and to be better doctors and to diagnose more problems that could lead to even greater problems down the road. And the other thing about this system is that when I shine a light in your eye to look, it's one light, it's one beam, there's nothing special about that light. But with this camera system, I'm able through the software to change the filters that we're looking at this image with, and that way I can image different layers of your retina to see, if I do find something, what layer in the retina is it located in, which can then help me diagnose what the problem is. So just something new, something to be aware of. This is not brand new, it's been around for a few years, but is getting more popular. The biggest problem about the popularity of this camera is it's over $100,000 to buy this instrument. So it's had a little trouble catching hold that a lot of doctors are buying it because of the price. It's many times more expensive than a regular camera, but it does a lot more things than a regular camera. So if you have any questions about this camera or this system or anything along that line, or other questions, obviously you can always try to contact us through the website. If not, may God grant you with healthy eyes and great vision. You have to push it once.
Oh, I thought I did.